Oh, so let's do this. Let's get to Getty Israel, who is founder and CEO of Sisters in Birth, a population health expert and author and mother. Getty, can you hear everything? She's probably going to need the earphones. Oh, got the earphones on. Pull the microphone up to you a little bit closer. Leave lipstick on it. Maybe not quite that close. Oh, my goodness. Then, Perez, would you get us some lipstick, sir? I'm just joking. How are you, ma'am? Appreciate you coming.
Thank you.
Okay, you settle down? Everything is okay?
Yes, sir.
Okay, let's do this thing. Let's talk about this. A little bit about you. Who are you, and how did you get in here, and how did you form this organization, first of all?
Well, first of all, thanks for having me.
You got it.
Love your voice.
Thank you, ma'am, and you can speak up a little bit. It won't hurt.
I said I love your voice.
Thank you. I like to hear that. I heard it. I just wanted to hear it twice.
Again.
No, go ahead.
Well, you said my name and the name of my organization. I am a resident native born in Mississippi, reared, or as some of us would say, raised in Mississippi. And
our teachers always told us never say raise. You raise farm animals.
Right.
You rear.
Rear.
That was public education back in our day. What town did you grow up in?
Jefferson County. I'm a country woman, country
girl.
girl.
How about that? All right, go ahead.
And got involved in public health in 2004 while in graduate school, and started this organization in 2016. Opened its doors in Jackson in 2019. And the purpose of the organization is to reduce birth disparities in Mississippi, which are the highest in our nation every year.
My understanding, and I did listen to a couple of the interviews that you had prior to this, and I first of all, I salute your advocacy on this, because it's very, very difficult. I mean, and we all know this. How do you do this? We've been working on poverty for decades and decades and decades, and it just seems to be systemically generational, and nobody has the answer to this. But let's talk about some of the statistics here. And we don't look good in the state of Mississippi as far as how we fare in the nation. We are number one in teen pregnancy. We're the lowest life expectancy in the U.S., brought down certainly by the poorest of the poor. Highest infant mortality rate, highest rate of abortions among black women per population. Why is that? What are we not doing that we need to be doing?
I got a feeling you know. But
well, I do know. I mean, I have. But I mean, if that's the case, I really know what it is, and you really know what it is. We need to share it with the people in under the dome and in Washington.
Well, they know too. But for the record, we'll talk about it. So we can do something about poverty. First of all, most households in Mississippi that are impoverished are headed by women. Women represent, over 50% of our workforce here in Mississippi? And most of those women are working cashier jobs. Many of those women are heading households that are poor. You know, we have the highest child poverty rate and the highest child extreme poverty rate. Those rates or those lives of poverty-stricken children are occurring again, residing within households that are headed by women. Right here in Hinds County, I think it's like 60%. So what can we do about that? Well, when those women become pregnant and they don't already have a college degree, and let me say this, only 10% of the pregnant population in Mississippi have a college degree. That's the overall population. 6% of black women who are pregnant and have a baby have a college degree, and about 11.5% of white women who are pregnant. That's whether they're married or not, they don't or they do have a college degree, 10% overall. So that's extremely low. You don't have a college degree, you don't have many options. You really don't. So many of those women end up getting the first job they can get, the easiest job they can get, cashier, working in a retail store, working in fast food, working in service, home health, whatever's quickest. And they end up stuck in those positions. And I know you will want to hear this part. Many of those jobs are being provided by not small businesses, but by corporations that are exploiting our tax dollar, because those corporations do not provide any health benefits to those women. That is why almost 70% of births, pregnancies and births that occur in Mississippi are covered by our tax dollars. Medicaid.
All right, I can't argue with that because I don't know if the McDonald's don't offer for full-time employees health insurance or not. I'm not sure. Popeyes, and I can't argue with that because I don't know if that's a fact or not.
Many of those organizations won't allow them to even work full-time. They will work them 39 hours or whatever, in getting close to 40 to a 40-hour work week, but not technically a full-time person. So I'm not required to give you any full-time benefits.
Right, but Getty, here's the just to push back a little bit. Here's where I find an issue with that.
What?
And you're blaming the poverty on the McDonald's and these people.
That's not what I said.
But you got to back it up a little bit. How did they get here? And instead of blaming where they are now, and at least have a job, back it up and find out if you want to find a solution.
Well,
where is it?
Well, like I said, college education is a solution. But if you get stuck on a job where you're pretty much working all the time, you don't have time to go back to school and get that college degree. Many women who go to school and try to go to school, they have a baby, they become pregnant, they're going to do one of two things. They're going to have an abortion or they're going to drop out of school. Either way, it's a struggle for a woman, particularly if you're not married, don't have a strong support system to get that college degree. Women who have a college degree are less likely to have to experience infant mortality, less likely to have a premature baby, less likely to have an abortion.
Yeah. So, and that's where those stats are coming from because of all the things, the aforementioned things that you just said.
And so,
but again, we got a break here. We'll come back. We've got a lot of time to talk about this.
Okay.
So if we really want to find a solution, and that's what your organization wants to do, then we have to be honest about that and go back. Let's back it up way before the McDonald's or the Popeyes fried chicken, way before this. The solutions may rest in the home unit because there's not a father in that family. The life choices they make when they leave home, such as getting pregnant or not. And will government money or other opportunities, no matter how vast they are, help anything unless they help themselves?
Okay.
We'll talk about that when we come back.
Okay.
Little John Hurt music with some wisdom. Getty Israel, founder, CEO of Sisters in Birth. And we'll continue conversation. And so give me an outline of what you think the solutions are and where we need to go.
Well, you mentioned something earlier. It begins with personal responsibility. We get that. I think we all can agree on that. But personal responsibility is also connected to corporate responsibility, social responsibility, and government responsibility. We all, as a society, play a role in this. It starts with the individual. Individuals make mistakes. Individuals make decisions based on limited information, based on the fact that they may or may not have access to the right information or the right tools or right resources. Give you an example. We should make sure that every woman who's in the reproductive age group, meaning she can get pregnant at any time, has easy access to the most effective form of contraception. Unintended births. Number one reason women seek an abortion. They didn't intend to have the baby. They didn't intend to become pregnant. They became pregnant because in many cases they're using the wrong form. Why are they using the wrong form? Because in Mississippi we have maternity deserts. That means we don't have providers, OB providers, obstetrician providers in communities, particularly small communities. We don't have health care providers where women can go in and get the care, get the education, get the information they need, get access to the most effective form of abortion, most effective form of contraception, which is 99% effective. OBs are pretty much in the greater Jackson area, in the urban areas. They are not available or accessible in many of our communities. Nurse practitioners can't practice in these communities because we have a stupid law that ties them to a doctor, and the doctor wants to get paid more money just to say he'll collaborate with them. You've had people on your show talking about that. Yeah. So we cannot eradicate these maternity deserts, and people don't have access to providers. Well, that's where it starts there. Lack of education, lack of access to these resources.
Right, but Getty, have our schools failed us?
But it's not just schools.
This?
It's not just schools. It's family.
Well, that's true. I agree with you 100%.
It's family. It's community failing. It's schools. It's the state government, it's local government, it's the medical system or the healthcare system. It's all of us failing us.
Let me say this too, and don't take this in the wrong way, but whether it's black or white, people who've climbed out of poverty, have never been in abject poverty, who work their butts off, and look, I got a long line, and there's some people who are sending some stuff on C-Spire text line, giving me stories also, of black and white moms who work their butts off, work 2 or 3 jobs, they've climbed out of poverty, and they've done the right thing and raised an incredible child, and we understand that. But you got to go back and look at personal responsibility. We had a conversation not long ago about how some of this happens as far as teen pregnancy. And I was told that a lot of times these kids at that age didn't realize they could get pregnant this easy. And it blew my mind. I couldn't understand that. I would think with social media, these kids more checked out on sex at a younger age now than ever before. They didn't have to wait to go behind a barn 50 or 60 years ago. Plus the fact, we heard yesterday that there was like 75, 76% of kids in the college age don't even know about the fentanyl in opioids and these pill press bills. I don't understand that. You're telling me that a lot of these kids didn't realize they could get pregnant at that age.
Well, look, unintended pregnancies don't merely occur among the teenage population. The average age is, I think, about 23, 24, 25 years old. But it goes back to lack of education, lack of information. If those teens were receiving primary care or obstetrical care from a provider in their community, they would probably know. We're not providing them with evidence-based information, and teachers can't do everything. They just can't. And then you have parents who don't want their kids to be taught about comprehensive sex education. So people go
why was that? I mean, you mean even in high school?
Well, you have parents right now who don't want their kids exposed to sex education. They, for whatever reason.
I'll disagree with you if it's appropriate. There's a line there where you cross over, and we can get into the CRT and things such as that. But there is there in some of the gender stuff going on. But there is a line. I don't think most people, if it's health management or in health when they're in the 10th, 11th, and 12th grade, have a problem with that if it's done in the right way.
Well, we have our history here in Mississippi fighting over that. The politics of all of that, of comprehensive sex education, abstinence only. For a very long time, it was only abstinence only. You could only talk to kids about not having sex.
Yeah, we've thrown that out. We've thrown that out the window.
Well, finally. But here's the point. The point is you're pregnant now. Doesn't really matter how you got here. We know you're pregnant now. So what we should be trying to do is reduce birth disparities among these groups. That's what we really should be trying to do. What we should be trying to do is move this population out of poverty. And here's a way we can do that. Yes, we have young women whose talents and whose skills have not been tapped into. As I said earlier, they are working what I call dead-end jobs, not getting any health benefits. They're going to rely and be stuck on state government for health care almost indefinitely because they're working jobs that will never pay them health benefits. And let me finish. They need to be going to community college, getting that 2-year degree in a health-related field because the healthcare industry is the second largest.
What's stopping them from doing that?
Okay, there are various reasons. There was a report that came out in 2014, and I think the Mississippi Women's, I can't think of the name of the organization, Mississippi Women's Foundation, I think, was a part of that or a sponsor of that study, and they found that women who are going to community college, one of the main reasons, 2 main reasons they drop out of college is pregnancy is one, lack of child care, transportation is an issue, and financing it. And I think stress was involved.
Well, financing it, there are ways to do it. Look.
But the point here, listen, the point is this. Research shows these things, so why don't we address those things? That's the purpose of research.
How do I address, when you say government is made up of the people, black, white, brown, doesn't matter. how can I address a black teenager that I don't know somewhere else getting pregnant? I mean, how is that my fault as part of the government?
No one said it was your fault. No one's placing blame. Listen. Nobody's placing blame here. You want to talk about solutions? I'm talking about solutions. I'm saying that if we invest in creating an intervention targeting this group that we know is at risk.
I don't disagree with that. I mean, all of the things that we have. Let me say this: when you go to corporate, I think that's the sand built upon sand, because corporate in 5 or 10 years, what's going to happen with them? They're going to have more robots doing those jobs. They'll find a way to lessen, even if they do go up on the hourly wages. It'll be a lot less people having jobs in those places,
I agree
because
with
that's
that.
what that always happens. So don't build the future on that. You got to go back, step back to the family, step back to getting these kids motivated. Let me say this, Getty. This show over the decades has been ground zero for literally hundreds, it's hundreds of hours, probably a lot more than that, to getting people information on government services here. To not only giving them, pleading, please take advantage of it, prenatal to infancy, child care, health information, free food from infants to SNAP, free transportation to health clinics or to a job interview, free information and training. If you've dropped out of school, workforce development training, if you've got a disability, there are so many different. We have spent literally countless hours trying to beg people, take advantage of this so you can climb out of that poverty basket. And the numbers are literally billions of dollars that go towards that in taxpayer money to operate those.
Okay, and let's not forget the billions of dollars we spend in corporate welfare, too, because we're giving billions of dollars to corporations to just come to Mississippi and create a few jobs. I mean, that's not right. No,
as far as a few jobs,
well,
that's totally wrong.
Well, no,
everybody
I disagree.
competes with that.
I disagree.
Well, it's taxes that we would not get in the first part. Secondly, if we did that, we would be Essequina County.
The bottom line is you have public welfare, you have corporate welfare. Both groups benefit. I don't have a problem with it. What I'm trying to say is there are things that we can do to reduce birth disparities. And you can't.
I'll give you the last word. We'll take a quick break here. But the only thing I'm going to say is what separates the young black who becomes a successful entrepreneur from the worst possible scenario of a mother who's on drugs, no dad.
The same.
What separates that from the other ones? And I'll ask you that question when we come back. Hold on. Load it up because this is a quick break. Back in a moment. Smart Studios with Getty Israel. I've enjoyed the conversation. Give you the final thoughts here on how we move forward, and have you seen any successes thus far as the organization is concerned?
Look, we have a lot of success. We are helping pregnant women to have healthy babies. That's what we do best. But before I leave here, I have to say this. We can do a much better job if we have the support of the state. We are not getting support from the state of Mississippi. We are not getting support from managed care organizations that have contracts with Medicaid that should be paying for the many services we provide at no cost to women, like home visitation, support during labor and delivery, childbirth education, breastfeeding counseling. I've been meeting with the CEOs and the chief financial officers and the chief medical officers of Molina, United Healthcare, and Mississippi Magnolia since 2016, showing them the evidence, showing them the numbers, that providing this kind of intervention helps to address obesity, which is a major problem in our state for women. When they become pregnant, many are already overweight, puts them at risk of heart disease, #1 killer of a woman who had a baby, hypertension, preeclampsia, diabetes. I've shown them the numbers over and over again, and I still have not been able to get these organizations that benefit from our work, because each time we reduce or prevent, I want to say prevent, a premature baby from being born in this state, which can cost millions of dollars, they benefit. We save them money, and we save the state money. I've been before the state. I've met with the chairs and vice chairs of appropriation in the House and the Senate. I've asked for funding to build Mississippi's first birth center so that we can staff it with nurse midwives, because we know that the midwifery model significantly reduces birth disparities, premature babies, low birth weight babies, chronic conditions, maternal morbidities, increases breastfeeding rates, and I couldn't get any help from the state. So no help from corporate, no help from state, and yet we continue to experience these horrible numbers every year. There are solutions. We need to pass the Pregnant Workers Fairness Act, which will protect pregnant women in the workplace. There are women being discriminated against in our places of employment in the state because they have no protection, no accommodations, which can lead to premature babies. So let me just say this. We as a state can't say that we want to be or that we are a pro-life state without addressing these issues. These are pro-life issues. I heard Governor Tate Reeves say that the pro-life movement, and I'm paraphrasing, is now in phase 2. And in phase 2, he intends to do more to improve birth outcomes. Well, here is how we do it. Evidence-based strategies that we know can reduce premature births. We have the highest rate of premature births every year. Babies dying before their first birthday, fetal deaths, deaths occurring in utero. We can prevent these things if we put certain things in place, and simply giving money to pregnancy resource centers is not enough, because pregnancy resource centers are not clinics and they do not provide the kind of health care and community health services that we provide. So I would like to meet with Governor Tate Reeves and his team to talk about pro-life phase 2, because I would like to be involved in that.
Well put. A lot of what you say leads back to if we had all of those in place, the things that are possible, then we don't have to even have a debate on abortion, because the mother would rear the child, and we would be okay there. I think on your mission statement, and I always see this, and I see it again on C Spire, the 3 things that would change it, that makes your job not even needed anymore, is if the 3 steps, and it should be your mission statement, to escape poverty. Number 1, keep a full-time job. Number 2, graduate high school or the equivalent. And number 3, wait to have a child until you are married or older, 21 years old, older than 21. If you do those simple 3 things, not simple, of course, but people who do that are 75% in the middle class. In other words, your chances are 75%. People who don't are, in Americans who follow all 3 rules, only 2% of those live in poverty. The Americans who follow none of those, only 7% are in middle class. 70% live in poverty if they don't follow those 3 things. Have a full-time job, graduate high school or the equivalent, wait for children, have children when you're married, or at least older than 21 years old. So I thank you for joining us. I know your objective at the end of the day with your mission is to decrease the needless killing of African-American babies and to make sure that these people have a life outside of poverty and outside of subsidies. And for that, I do commend you for it. Thank you for coming in. I appreciate it very much. Don't be a stranger. Love to have you back.
Thank you.
When you after the meeting with Tate Reeves.
Okay.
Okay?
All right.
Thank you, ma'am.